What if a chemical in your everyday plastic items was silently damaging hearts and costing the global economy trillions? Today we're talking about DEHP, and the evidence is alarming. This common ingredient, used to make plastics flexible, is lurking in your food containers, medical gear, even your shampoo, and it's been strongly linked to serious heart problems. DEHP, that's di2-ethylhexyl phthalate, isn't just a harmless additive. Research shows it can cause inflammation in our heart's arteries, significantly increasing the risk of heart attacks and strokes. A groundbreaking 2025 study, published in the Lancet eBioMedicine by NYU Langone health researchers, has unveiled the shocking global scale of this issue. Analyzing data from over 200 countries, they found that in 2018 alone, DEHP exposure was associated with an estimated 356,238 deaths from heart disease in people aged 55 to 64. That's over 13% of all global heart disease deaths within that specific age group for that single year. Let that sink in. Now let's talk money. The financial toll is almost beyond belief. Estimates for the annual economic damage caused by DEHP exposure range wildly, from $10.2 billion to a mind-boggling $3.74 trillion. One study pinned a more specific figure at $510 billion annually, with the potential to reach as high as $3.7 trillion. These aren't just abstract numbers. They represent real healthcare expenditures, lost wages, and the broader societal impact of people dying prematurely. For example, looking just at the U.S. population aged 55 to 64, one analysis estimated that DEHP exposure led to between 90,761 and 107,283 attributable deaths per year. The economic fallout? Between $39.9 and $47.1 billion in lost productivity annually. Another study, using 2015 data for the same age group, linked DEHP exposure to about 164,000 deaths and economic losses of $398 billion. And this heavy burden isn't distributed evenly across the globe. Regions like Asia, particularly South and East Asia, the Middle East, and the Pacific, are disproportionately affected, accounting for roughly 3/4 of the estimated deaths. India, for example, recorded the highest number of DEHP attributable heart disease deaths globally in that 2018 study, with an estimated 103,587 fatalities in the 55 to 64 age group. This is attributed to factors like the rapid expansion of its plastics industry, widespread use of products containing DEHP, and potentially weaker regulatory controls compared to some other nations. While countries like Canada, Japan, Australia, and the United States began addressing these concerns earlier, efforts in major plastic-producing and consuming nations like China and India started later. But the danger doesn't stop at heart disease. DEHP exposure has also been associated with a host of other health problems, including obesity, diabetes, fertility issues, and even cancer. When DEHP breaks down in the body, it can lead to hormonal disruptions and impaired metabolism. This growing body of evidence truly underscores an urgent need. We need greater public awareness about DEHP. We need more robust global regulations to reduce our exposure. And we absolutely need continued research into the full scope of its health and economic impacts. This is a silent threat, but its consequences are incredibly loud and far-reaching. Thanks for listening.